Thank you for joining us. My name is Joette Springle, Vice President of Business Development and Marketing with Legacy Healthcare Services. And today we're talking about an important update that healthcare providers need to know about. We've invited Julie Galla, VP of Clinical Strategies from Health Pro Heritage, to walk us through the changes and what they mean for outpatient therapy services. Can you explain what the new GA modifier requirement is for United Healthcare's commercial plans that started on February 1st, 2025?
Beginning February 1st, 2025, United Healthcare, or UHC, introduced a new requirement for claims under its commercial plans. If a healthcare provider knows or suspects that a service is not covered under a patient's benefits, they must submit a GA modifier with the claim if they plan to go ahead and bill for the patient's non-covered service. And this purpose is to improve that transparency and ensure that patients are made aware ahead of time of their potential out-of-pocket costs before receiving a service.
Gotcha. Okay, so to help me, and I'm sure maybe some other listeners out there, what exactly is the GA modifier and how does it work in practice?
The GA modifier is essentially a coding tool that's used to indicate that the patient has been properly informed about that non-coverage of the service and that written consent was obtained. So this modifier is going to help document that the patient understood and agreed to their financial responsibility for the service. It must be included with the claims where the provider has met all the consent requirements outlined in UHC's protocol.
Gotcha. So what are the key consent requirements for providers in this new protocol?
Yes. So those main consent requirements are that providers must ensure patients are clearly informed about the potential costs of a service that may not be covered by their benefits, including giving the patient an understanding of the financial responsibility they may have for their service and obtaining that written consent. Providers must meet these content requirements before submitting the GA modifier. And if those requirements aren't fully met, the GA modifier should not be used and billing the patient would not be appropriate.
Let me ask you a question. What happens if a provider fails to meet these consent requirements and submits the GA modifier anyway?
Great, important question. So if a provider submits the GA modifier without meeting the consent requirements, they could face claim rejection and the patient should not be billed. The GA modifier is only valid if all those consent guidelines in the protocol are followed. This is going to reinforce the importance of making sure the consent process is thoroughly completed and documented, because if it isn't documented, it didn't happen.
So how does this new requirement align with the broader goal of improving healthcare transparency?
So the ultimate goal really of this change is to make sure that patients are fully informed about their potential costs before undergoing services. By requiring that patients give written consent when a service isn't covered and that the GA modifier is used when applicable, UHC is aiming to improve that transparency around billing as well as member liability. So this way, patients have more clarity and can avoid those unexpected financial surprises when it comes to their healthcare.
What should providers do to prepare for this new requirement?
Providers should and need to familiarize themselves with the new requirements in those 2025 Administrative Guide for Commercial Plans. They'll need to ensure that their consent processes are updated to meet UHC's criteria and that they have clear systems in place for including the GA modifier on claims when it's appropriate. Education and staff training will be key to ensuring, especially with those billing departments, compliance with these new guidelines.
Is there anything else that you think providers should keep in mind as they begin implementing this change?
I think just reiterating the importance for providers to maintain that clear and documented process for obtaining the written consent, as well as communicating with patients about those potential costs.
So, Julie, where can our listeners find out this information that UHC has put out about the GA modifier?
All our viewers can look at the bottom of that screen, and we're going to have that web link popping up for you to be able to have easy and quick access to that link.
That is great. Thank you again for all this information today, Julie. It's been a great help. And thanks to all our listeners. We appreciate you tuning in.